As most people in the industry know, as I travel around the world, I'm always seeking out new and dynamic techniques from the world's leaders as manual therapy can help patients in pain. But the other thing that I'm really excited about is I've spent my whole lifetime also seeking out anything that can complement the relief of pain. And as I discovered by accident, actually, I actually fractured my femoral head of my hip. It was just a hairline fracture, but I had fallen and injured my hip. And after my chiropractor really described it after an x-ray as one of the most necrotic hip tissue injuries he'd seen in quite a while, I had been hearing from a long time from some of my teaching assistants and colleagues the significant and powerful effects of CryoDerm. And as you know, I've worked with various companies around, some of the top companies in the industry, and I've been exposed to some of the greatest products in our industry. But nothing that I used actually eliminated my pain. And so out of desperation, when my pain was about a scale of a 9 out of 10, I just took this roll-on and rubbed it throughout my hip. And actually within 30 minutes, I was sleeping with zero pain in my hip. And what that allowed is the pain spasm cycle to break. And that allowed me to then have the therapy required to release my capsule and balance up my muscles. And I'm now walking pain-free. And this is not a lot of months after that pretty drastic injury. So through the evolution of working with CryoDerm, what we've decided is I've always sought out a product, a myofascial warming ointment. And what I wanted it to be is I wanted it to be 100% natural. I didn't want any allergies or anything that people might be sensitive to in the product. And what I really strive for as I worked with some of the leaders in the industry is I strive for the perfection of the perfect viscosity. Viscosity means when you apply an ointment, if it causes too much glide, it makes it impossible to hook the superficial to deep fascial layers. You just slip over the tissue. So over repetitive feedbacks to the chemist and repetitive updates in the viscosity, not only did we come up with that, but we came up with something that was perfect and all natural to meet the needs of all manual therapists to take your practice to the next level. So what I'm excited about is the new CryoDerm myofascial warming ointment. It was designed by leading manual therapists for leading manual therapists. It includes MSM, arnica, boswellia, coquillo nut oil, peppermint oil, which creates some of the warming effect. The capsulation, which again creates a true warming effect. The ginger, and again the Saigon cinnamon, which again brings true warmth to the superficial fascial layers, and the ilex. And the great thing about this product is that not only is it all natural with the perfect viscosity, but it's paraffin-free, it's gluten-free, and it's lanolin-free. And those are some of the things over the years my clients, seminar participants have said, I've got sensitivities, I've got allergies, I really can't use some of the products I've been using, and could you find something without that? So I'm really excited to say that the Center for Pain Management is now behind 100% CryoDerm. We will be developing new products in the future. We're excited to make manual therapy go to the next level, and I hope you join us with the video, the products, and the best interest of your patients, which is eliminating pain, giving them pain-free life, and giving them an active lifestyle, and giving the athletes the optimal performance possible. So whether you're a chiropractor, physical therapist, athletic trainer, massage therapist, osteopath, physician, I hope that you want the opportunity to get your people out of pain.
Welcome to the educational series entitled How Does CryoDerm Work? My name is Dr. Kaplan. CryoDerm is all-natural cold therapy, popular in sports medicine, chiropractic, physical therapy, rehab, and massage. CryoDerm contains many all-natural active ingredients, plant extracts, and oils such as peppermint, arnica, eucalyptus, ilex, MSM, boswellia, and many more. The main action of CryoDerm can be explained by the gate theory of pain. The pain is perceived by pain sensor neurons in the skin that send the signals through the sensory neurons to the dorsal root ganglia, where the interneuron, or the gatekeeper interneuron, opens the gate and allows the pain sensation to pass onto the brain freely when only pain is present. Therefore, we feel pain. CryoDerm stimulates the cold-sensing neurons in the skin that close the gate to the pain by acting on the gatekeeper interneuron, and therefore the pain sensation is no longer transmitted to the brain. CryoDerm stops the pain naturally by closing the gate to the sensation of pain via the gatekeeper theory of pain.